Welcome to State of Reform's virtual series, 5 Slides We're Discussing, with some of healthcare's most thoughtful leaders. And now, the host of State of Reform, DJ Wilson.
Hello and welcome to another edition of 5 Slides We're Discussing here at State of Reform. I appreciate you making time to be with us here on June 19th, which is the National Day of Celebration to commemorate the ending of slavery in America. And given not just Juneteenth, but the civil unrest related to police brutality and the murders of folks, particularly African Americans in the United States in the last few weeks, we wanted to host a conversation specifically about being leaders in healthcare, leaders in America from the Black perspective, folks who have really been dynamos in terms of both administration and policymaking in the area of healthcare across, in this case, 3 states. To jump right in, we have Eric Hunter, the president and CEO of CareOregon. We've got Demetria Malloy, the senior medical director for the California Medicaid plan at Anthem Blue Cross, and a 30-year veteran of the legislature in Texas. We've got Representative Garnet Coleman. Thank you all for being with us. I appreciate it. Eric, let me start with you. I want to just get a sense, sir. Tell us about yourself. Tell us about CareOregon. Tell us about the work that you're doing, and give us a rundown of how you come to this conversation.
All right, thank you, DJ. I appreciate the opportunity to talk to you and the others. It is important that we have these conversations, particularly now. Unfortunately, that it takes situations like this to have these conversations, but let's take advantage of the momentum that we have and try to make some real change. So I'm the CEO of CareOregon. We serve about just under 400,000 Oregonians, primarily in the Medicaid space, also the duals program. We have some tribal care management programs as well, and are really one of the primary community benefit organizations in the state of Oregon. 26 years now of doing the best for folks as a mission-based nonprofit. We have tried from our inception to really treat everyone as they need to be treated and recognize the need for equity, diversity, and inclusion in everything we do. I'm lucky to have this position. It didn't seem sort of likely that I'd be in Portland, Oregon, growing up an Army brat on a little base in southern Arizona. A father who was a medical lab tech and a mother was a nurse. Working there in the government, I got to see all kinds of people and deal with all kinds of things, but decided I wanted to go to college in Oklahoma, where my world changed quite a bit, a whole different environment. I went to the University of Tulsa, where, interestingly enough, I'd been there for 3 years before I ever heard of the race massacre of 1921. Even in Tulsa, it wasn't spoken of, and that's why it's interesting that so many people are learning about it now. So there are things that are unheard and unseen that hopefully we can start to change. I've done work in the governor's office in Oklahoma, in the state agencies, and in a number of private sector companies all across the country, in Baltimore and Boston and Nashville, Dallas, South Carolina, obviously Portland, Arizona. And so I think I've been around a lot of different places to see how folks interact with each other and where the accountability for treating folks like human beings really comes from. So I'm excited to have an opportunity to talk about sort of some of the things that are happening now, and hopefully some of the things that we're doing as CareOregon, some of the things I would encourage my colleagues to do, and conversations that we need to continue to have to really move the bar, because we can't just have another conversation, put social media posts out there, and have folks be performative and feel like they're doing something, and then 3 weeks from now, go back to business as usual. This has to be real, and I'm hoping we'd have that conversation.
Yeah, good stuff. That's a varied background. I appreciate you being with us, Eric. Demetria, let me ask you same kind of question. Tell us about the work you're doing at Anthem California Medicaid, and the sort of your story that brings you to the conversation today.
Absolutely. Thanks so much for having me. I'm really excited actually to be my co-panelists here and be able to represent sort of a number of perspectives on this really important topic. I've been working with Anthem for the last few years and other managed care plans prior to that, and then also trained in health services research and working with academic institutions prior to that. Anthem is, I work with the Medicaid team for the state of California, and we cover about 1.2 million members over 29 counties. Have a number of different programs, and where I work mostly is on driving our clinical performance levels, and also on collaboration and a lot of innovation within how do we give services to our members and partner to do that in the best way possible at the highest level possible. I'm an internist. I'm mostly raised in California by a single mother who has worked very hard to give me opportunities. And there's plenty of stories I have personally growing up that motivated me from her as well, and ways that she could counsel me as I dealt with my own issues of discrimination growing up as well. And have studied mostly undergrad in California, and then back east in Boston for medical school as well, and training out back in California for my clinical training. I think what's been important to me is after the clinical training, I sort of wanted to look at some of the broader issues with our system and our healthcare system. And so I did additional training in how to sort of lead on health services research projects and look at public health issues more, and how to integrate that into how do we work with providers, how do we work with patients, and some of my research has been on the provider-patient relationship, and then some adherence issues and differences that may be with different kinds of providers, even based on race, gender, those sorts of things, and how we can get better outcomes for all of our patients. So a number of issues kind of caused me to then come into managed care and look from the health plan perspective, and how it is that the payer deals with constructing programs for that, making sure that there are availability for what members actually really need, and how we're paying for them, and making sure that's sustainable over time. So happy to have this discussion, and thank you for having me.
Yeah, thanks, Demetria. And Garnet, tell us about yourself and your experience that brings you to this conversation. 30 years in the Texas legislature. I understand politics is infused in the legislative system, and being out of Houston, you're sort of you've been representing the African American community as a leader in the caucus in that state, and you've served on Public Health Committee and Texas the Select House Committee on Healthcare Costs. You've been involved in all kinds of conversations from race to healthcare. Tell us about your background a little bit and the work you're doing.
So I was first elected in fall of 1991 in a special election. My predecessor died in office. And I started working on healthcare almost immediately because there was clearly a need. But my father and father-in-law were both physicians, both OB-GYNs. My father-in-law was in California, in Los Angeles, and my father here in Texas. They both went to Howard Medical School. So I was raised around healthcare, but most importantly, I was raised around the idea that people didn't have access to healthcare, and that we had a segregated healthcare system. I was born in the equivalent of the hospital here in Houston, Houston Hospital for Negroes, but I was born in Freedman's Hospital at Howard University on the campus. And there were two hospitals that where Black doctors had privileges, either Providence or Howard University, the hospital there, which was Freedman's Hospital. So I kind of came into this with this idea that we were trying to find equality in healthcare, for everyone, and knowing that there was clearly a problem based on whether or not you could get care based on the color of your skin, and also how Black doctors approach providing healthcare, and whether or not they were able to do so in the same way as their white counterparts. So I worked on writing Medicaid managed care bills from 1993 till now, and worked on, authored the CHIP bill when we first started doing our S-CHIP bill, and also children's Medicaid, and today trying to get people care under the Affordable Care Act. Work with the Obama administration as one of the 32 members of the president's White House working group of state legislators for health reform. And that was a real honor, and we're still fighting the fight and the battle. But I think it's done a lot of good for people. One place that I think many states have fallen behind, but particularly Texas, is we're not doing the things in public health in general, population public health, that we used to do. And I think that has an impact on communities of color, and particularly the collection of statistics that have to do with disparities based on region, skin color, race, those types of things, and particularly in the Southern United States.
Yeah, good stuff. Thanks to each of you guys, not just for your service, your professional and public service, but for being part of this conversation. Eric, let me come back to you. This has been a unique time in American history because of the social unrest. Not unique in terms of deaths to African Americans by the hands of police or other law enforcement officials, but it's a unique time where people are rising up and taking to the streets and trying to do something about it in a little more broad-based sort of way. What do you make of these last few weeks, professionally, personally? What do you make of these last few weeks? Any observations on what we're going through as a society right now?
Yeah, DJ, I think that for me, it is encouraging that so many people of so many hues and so many countries have recognized that the issue isn't about necessarily economics or riots or looting or about even law enforcement. It's about basic humanity, and the lack quite often for folks not to get that understanding that they have a basic humanity to be treated like human beings like anyone else, and that some lives are less important than others. And there's a quote I read that I can't take any ownership of, but I just loved it when I saw it, that George Floyd wasn't a wake-up call. The alarm has been going off for over 400 years. The difference is now people have gotten out of bed. We're not hitting that snooze button anymore. And so if ever there was a time that we could rally with folks that support the cause of basic humanity and racial justice, this is it. We need to take advantage of it. I think that an important piece of it is to recognize, as I have a long time ago, and I hope most people do, is that, Black people cannot fix these things ourselves. We can do everything we can to make our lives better and to help our communities and work through our organizations. But it's really the folks that have authority and power, that design school funding, that design education curriculum, that design laws and how they're enforced, that have to be allied with us to make those substantive changes that will give folks an opportunity to just stand up and do what they can do for their God-given ability. So I think it's a shame that it took this long to get this kind of pressure. I hope it's real this time. Like the others, I'm sure this is not the first time there's been unrest or mobilization of the public. Every few years, something comes up where we have to do it again. I just hope this is one that has sort of lasting impact and changes those policies and systematic issues that cause these problems, and not just sort of paper over them. Yeah.
Demetria, how do you make sense of what's happening today, given some of the personal experiences you spoke to in your introductory comments, your profession now as a physician executive leader at a health plan, dealing with Medicaid beneficiaries and trying to grapple in that capacity with things like social determinants of health, which are often adjacent to this racism conversation or issues dealing with race. How are you making sense of this time over the last few weeks?
Yeah, it's such a big question. I've grappled with this quite a bit, and I think it's it's tough as a leader to be in the middle of figuring out how you feel about it and what to do with your own emotions, and yet still sort of try to direct others that are obviously dealing with that as well. And when I thought about it, I thought, what do you say sort of to tackle or deal with a problem that's like dust in the air? I mean, Kareem Abdul-Jabbar wrote this op-ed that said racism is like dust in the air, and now there's kind of just a light being shown on it. And I think I thought about it, we all kind of function and live in this world where the dust is in the air, but we learn to have some level of function in the dysfunction. And now I think what's happening is we're all present to that dysfunction and how it actually affects us. It was similar to me when we were dealing with COVID-19 and everyone had stay-at-home orders. And then when you would walk outside, you would realize how clear and beautiful the sky was, but you hadn't realized that you weren't enjoying that while you were functioning and living the whole rest of the time. And so now I think, so a couple of things, it's like you're present to maybe what could be better if we all work together and recognized how each of our little contributions feed into the overall environment that all of us have to live with. And some obviously carry an undue burden of that. And that's actually been, I think, much more clear at this point. People have been willing to face that and realize. But I think a couple of reasons why I use that sort of picture is because, we're all in this together. Each person's individual decisions on every little thing, whether it's to like stop a racist joke from happening, have someone sit at the table on a policy that's obviously going to affect everyone of all sorts so that the representation is equal. I mean, there's a whole range of things where in your sphere, you can influence it to make the overall environment for everyone better and to make sure that the action has lessens the undue burden that we know and we have come to more agreement that African Americans hold and people of color hold in this country. And so it's really learning to understand we're all in this together and as a teammate and to answer the question of what's your role in making this better. And you have to take an active one. Silence is not an option. That's actually a choice to not do something. And you have to say, what's your role? What's my sphere of influence? What can I do? And what can I do on a continual everyday basis to clear this dust from the air, right? We all suffer and there are those who suffer more, and it's part of my job to clear it.
Yeah, good stuff. That Kareem Abdul-Jabbar metaphor it's a powerful one and enlightening. Garnet, you've, like I say, fought a lot of fights. You spoke to that in your introductory comments vis-a-vis health policy, but also vis-a-vis race relations, being from a Houston area district, serving the people of your district and the people of the state of Texas. You have a little different perspective maybe than somebody watching in a state like Utah or a state like Washington. Put this time in some context for us. What about now is different than in other times of upheaval?
Okay, so let's start here. I passed the Sandra Bland Act in Texas in 2017 after her death in the Waller County Jail. We tried to get really good policy done that would prevent things like that in the future, like de-escalation training, appropriate checks in county jails, but we weren't able to get rid of investigative stops. I look at what happened to George Floyd as also a wake-up call. He grew up in my district, about a mile from where any place I've lived in this district, and it tells me a lot about who he is and how he grew up. He went to the same high school my father went to. I mean, it's one of those kinds of things where I can feel him directly, and it becomes very, very personal. But I can feel it directly because I grew up, under a situation where the police were not our friends, and they created a lot of fear, and still do, for that matter. But we have to make progress, and that's what we tried to do with the Sandra Bland Act, listening to the police as we went through that bill. But now we have to get more. I represent a district that was created by the Voting Rights Act. I have a special obligation and responsibility to my constituents to look out for their needs. And so do the other members who represent districts that were created by the Voting Rights Act. I'm only the third member of the legislature who has represented this district. And it became a single member district in 1972 election. And so that tells you it hasn't been that long since we've actually had almost an equal say at the table. But healthcare is just like anything else. It is a right that people don't have equal access to. And we also know now very clearly that stress of racism creates illness in people. And along with the stress of being afraid of being stopped by the police and somebody telling you reach for your gun when you walk out of the door, it creates illnesses or susceptibility to illnesses like diabetes, hypertension, and heart disease that have really exacerbate health conditions like under COVID-19. So all of this stuff comes together. What is it about being Black that makes you sicker and sicker than other people out there and die more earlier and more frequently from certain diseases? So I'm hoping we bring all of this together to understand by everyone what we can do to diminish those health outcomes that, quite frankly, my father-in-law died of heart disease at 65. My father died of lung disease and with complications of diabetes at 64. So that tells you that this idea of shortened death is a clear problem among African Americans, among Black people, and I hope we can refocus our attention on that by getting better statistics and using that to direct our efforts towards prevention of those illnesses and reduction of that stress.
Yeah. It reminds me of something I think maybe one of the three of you said in our pre-call earlier this week, which was race doesn't cause poor health outcomes. It's racism that causes poor health outcomes. Eric, I want to come to you with this question, but let me first remind folks that we're with Eric Hunter, the president and CEO of CareOregon, Demetria Malloy, the senior medical director of plan performance at California, Anthem Blue Cross California Medicaid plan, and Representative Garnet Coleman, 30-year member of the Texas legislature. I'm happy to take your questions if you can write them on the right and then upvote those. We've got a couple of good ones already teed up. This one, Eric, I want to ask you, this comes from Fathia Abdi, who I believe is at Community Health Plan of Washington, so a comparably community health centered organization. She asked, what are some steps that we can take to address institutional racism in the healthcare system and in the delivery system? And to paraphrase her ask a little bit, what are some steps either your organization or other organizations have done to help foster anti-racism?
Yeah, I think that's a great question. I think it falls along on what Representative Coleman was saying, is that racism really is a public health emergency. Much like everything else that we focus on, we just don't have the data to bring the accountability to those folks to actually do something about it, and then hold folks accountable to actually make things happen. So specifically, I think to the question, I would say even CareOregon, with our amazing teams and dedicated mission to serve the poor and most vulnerable, we don't do enough. I think that a lot of it starts with identifying concretely how these issues are manifested in human beings and in their care and in their lives. So we've been training analysts and business folks that do our data on understanding racial disparities and aggregating and disaggregating data by those categories that can show us what's really going on. If you just, for example, with COVID, if you just run the numbers on mortality or on hospitalizations or on ICUs for COVID overall, you get a number. But if you break that down, you see that in Oregon, African Americans are twice as likely to be hospitalized and 3 times as likely to die from the same thing. Hispanics have similar deals. And unless you break the data down like that, you don't even know about it to be able to speak to it and do something about it. So I think that's the first thing we're doing, is we're trying to say, how do we understand what is happening to people and put numbers on it? So, and unfortunately in healthcare, if you can put numbers on it, you can put dollars on it. If you can put dollars on it, you get action. And that's a lot of what we're trying to spend our efforts doing, aligning metrics with our providers and working with them to try to provide sort of whole person care that takes into account social determinants and the needs sort of beyond just presenting case. And one thing that I think that we don't do much that I'd love to see us do more of is working with teaching hospitals and medical schools to make sure that folks coming into the industry understand at the core that all people that present to you are not equal. And the things where they find them unequal have to be based on clinical needs, not on societal understanding. So for instance, if a white patient presents with back pain they might be more likely to be prescribed opioids or drugs, to deal with the pain, whereas Black and brown people presented with the same symptoms may not be presented with those options because they're seen as drug seeking. I mean, those kind of things are not, it's not someone being racist or trying to, it's just an understanding within themselves of how they see people and realizing that the accountability they have, it's hard to understand, and it can even feel like an attack if you aren't willing to acknowledge how your behaviors affect others. So I think it's data, it's accountability, and folks really trying to move the needle.
Yeah, Demetria, I recall when we had a panel of leaders at our 2019 Los Angeles State Reform Health Policy Conference that you were on. I asked you a similar question to one that Lori Munn poses that I'd like you to think about and address. At that time, I asked you about how you take your personal experience, your lived experience, and try to bring that to the leadership table at a health plan in a sector that is not as reflective, perhaps, of the people that it serves as possible, or as it could be. Lori specifically asked this question: how do you lobby the leadership of our organizations to act more boldly and decisively in standing up for racial equality, including lobbying for systemic changes related to housing, education, and other social determinants? So how do you work from the inside to kind of build this awareness and this culture that leads to change in the organization?
Yeah, thanks. I love this question. I feel like that is a lot of the work that I do now. I would certainly agree with Eric in that it does have to stand on somewhat of an objective platform to start that everyone can agree on and look at to a certain degree, which is, so data. But I think also that the accountability piece, like agreement on, what are we about as an organization? What are our goals? What are we doing? And speaking specifically to how increasing diversity, working on health equity, and certain particular specific programs underneath that serve those goals. I think that's usually a centering conversation that really helps move some of those forward and have support behind them, always bringing people back to a common touch base. And in that way too, I think then you can even expand out some of the goals or help people see a different perspective on how it is these particular programs that they may have never have considered or looked at or thought to implement even in the way that maybe I'm suggesting with a number of community partners and things like that, and how that is beneficial and how that can be done and how that does serve the overall mission and goals that everyone agrees on. So that's kind of the iterative process I tend to take with things. I think I have at my current organization been lucky in that they've been supportive of us building a health equity initiative under our Medicaid program since, obviously under our Medicaid team, we do take into more accounts things on social determinants of health and other things that are factors for people's health and their health status. And so I'd say particularly for a program underneath that has been successful, I'm excited about, is we focus on maternal birth equity. And I point that one out because the data there is undeniable and widely agreed upon. So you sort of start with that. But yet it's obviously a very important health outcome if you can't deliver a baby safely in this country. What are we about, kind of thing. And so, but in addressing that, and for African-American women, I think you have to look at different solutions than what people would just come up with on their own, maybe if they weren't an African-American woman or weren't sort of privy to those problems a bit. We've launched a doula program in particular ways, because I think you have to look at, like people have described here on this call, the effects of toxic stress and the stress of racism on all health conditions. And it's particularly trying on a pregnant Black woman at the time who can engage the system effectively, who feels maybe belittled, who feels not listened to, who is not having a good working relationship possibly with her caregivers and her providers. And so what you need to do is obviously you need to change that system. And we've actually worked with academic institutions on training for providers on bias and presenting the data and showing them you are part of this issue and you have to do something about it. But also I think on the patient side, making sure there are buffers against what is already known to be a system full of bias so that they can have support that helps them navigate that system to a more successful health outcome. So in particular, that's what the doula does. And so my push on it was obviously around the health outcomes, but it is, this is who we are, is that we are supposed to get people safely through their health journey and delivering the services they need. And this is one in particular that this population needs, that we have to pay attention to and we have to be about. Obviously, we have to follow it out with the data and everything, and that helps people stay on board and keep supporting. But I think, having that as a base and then arguing for, what actually serves the goals that everyone's agreed on, but particularly in anti-racist ways that help populations working through the system are ways to get at it.
Yeah, good stuff. Garnet, let me ask you this question from Marissa Luera. She's got a question that I think is, I'm going to paraphrase and try to tee up for you in a subtly different way. She asked, from a legislative perspective, and given how far apart the two sides seem, are there real opportunities to address these disparities in outcome from a public health and Medicaid angle? That's her question, but I wonder if you could take your experiences serving on the Public Health Committee for 30 years and being one of the lead authors on a number of Medicaid bills. How do we think about integrating those two efforts of public health and Medicaid so that they are not such separate silos in healthcare? How do we pull those together in a little more thoughtful way that will help to address some of the disparities that Marissa is asking about?
In Texas, I started the Disparities Task Force back in 2001. Unfortunately, the money was pulled out of it in 2017. So in Texas, we have to put that back so that we have the statistics that are necessary to see the outcomes among people who have in those disparities. The other part is that we have to use what we're going to use for law enforcement, and that's implicit bias training. People don't know what their biases are unless they are confronted with them and then work to stop that. And that I think that's important in public health when people and in care under Medicaid, when people tend to blame the patient for their problems as opposed to treating the patient's illness that exists and working to prevent those illnesses from occurring. So those are the things that I've seen where you pull those two things together, and even more so now, so that everyone understands, whether it's a Black doctor, whether it's a white doctor, whether it's a Latino doctor, that they all have points of view. And how to move past those points of view to provide that care, and also how to make sure that that care is offered in a real way. And that takes us back to primary care being the doorway that people go through, and our primary care providers, which would include internists, OB-GYNs, and the like, have to be educated very well about how to help their patients navigate through a system that may not understand them. I have 3 chronic conditions. And believe me, as much as I may know, I didn't know how to deal with my diabetes, with my hepatitis B, with my bipolar disorder. I mean, I'm walking around falling apart and just really didn't know how to deal with it. And they were comorbid. So getting the right information and moving in the right direction was very difficult till I got a number of doctors who worked together to show me the best way to move forward. So I say all that to say is, we could be educated about things, but that doesn't mean we really understand and know how to take care of ourselves. And that requires a very good team of people, starting with our primary care provider.
And Garnet, I want to just commend you for being so open and authentic about your chronic conditions, but particularly your bipolar disorder. You have helped to normalize conversation about mental health in a significant way in Texas. I think I want to just commend it. Former 3-term Oregon Governor John Kitzhaber is on this conversation with us, and I would say, as many people I think who know the governor or who have watched him over the years, he's really one of the most prominent, most impactful, and most important health policy thought leaders of our generation, I think. And so he wants to put you all to the test on this question. He says, Governor Kitzhaber says, Eric mentioned the need to connect the passion and the energy of the protests to a political and policymaking process to make these changes and address institutional and systemic racism. How do we, any thoughts on specific actions about how we measure progress over the months and years ahead? What do you think we should look towards? And any of you can answer, I'll let any of you jump in on this. What do we look towards to measure our progress? And as Tanya Kapka asks, related to this, how do we hold ourselves accountable?
So one of the things we did with jail suicides is reform how we dealt with jail suicides in our county jails using technology. And what we look at is whether there's a reduction in the number of jail suicides after we've implemented telemagistrate, telemental health, cameras and card swipes to look at those jail inmates to make sure they don't commit suicide. It is far from perfect. That came from Sandra Bland. I think in this case, well, how many circumstances are where either someone is harmed, killed, where there's violence, and have we reduced that, and to hold those officers in those police departments accountable through fine or firing or using citizens review commissions with subpoena power. We have to involve the people in this, whether it be in the healthcare side as well as in the side that comes with accountability by public officials and public safety officers.
Yeah. Eric or Demetria, you want to jump in on this question of accountability and measuring progress?
Yeah, I mean, I think one of the big things we can make sure we do is to continue to push our elected leaders to make changes that they can't just walk back from tomorrow, to put into place mechanisms by which there will be the continued dialogue about those things that Representative Coleman talked about, so that we can see what's happening in real time. In Portland, for example, they've done some shifting of funds in the police department to defund school resource officers and move monies to outreach and behavioral health and mental health folks that can go out and interject, so you don't need armed law enforcement being the first people that show up for a 911 call on somebody who's in distress. You know, those kind of things can be put into place now. Mechanisms by which the data about how people are treated is public. You know, stop hiding the P. If you know, I think there are a lot of efforts nationally to say we need a public database, national database on police misconduct, so that you don't go from one department to the other. I mean, those are the kind of things that will hold folks accountable and not let us sort of skate around it and speak to it here and ignore it over there. In the health side, I think there is no doubt that, again, we know how many people get different kinds of prescriptions. We know sort of wait times. We know access ability for different populations. And so, you know, we need to have the data and say, all right, here's where there's a food desert on social determinants. You know, how do we put a program there? Here's where there's social isolation. So it really is, it's making the information that we know about public and out there, so people can hold us accountable. I've got a board of directors that holds me accountable for this kind of work. And sometimes it'd be good if they even push me a little farther to say, what are we doing on this front? So leaders and their boards and those folks that actually have the authority need to do more than just talk about it, but actually say, this is a part of your job. Understanding this, speaking to this is a part of your job.
Yeah. Demetria, I want to ask you a little different question. And, you know, I grew up in a small town, almost all white folks. I'm a Gen Xer. My parents were boomers, and they thought, I think, the right way to raise their kids was to be colorblind. And growing up, I've, of course, since learned that leaves me no ability to appreciate the context of my friends and neighbors, people who are not white. I didn't have the tools to love them as fully as I wanted to know them as fully as I needed to. And so I have had to develop that, try to develop that vocabulary and that experience. I still don't have it. I still am working on it. At the same time, I've benefited from all of the institutional bias as a straight white man, that whether I knew it or not. At the same time, I thought I was colorblind, but I really wasn't, because I was still treating people differently because That's how we are in the real world. So tell me, if you would, what advice would you give people like me to be better, to just be better in this conversation? I don't, it is a topic that we are all endowed by our forefathers to wrestle with, and we all have to do better to be anti-racist and to remove this. How can I be better from the view of a Black woman to a white guy?
Mm-hmm. Well, while I think that probably the intention was good, or even the label when people say, I'm colorblind, I don't see color, I think they're missing a couple of key things there. In that actually people of other ethnicities other than white are usually very proud that they are what they are. And so they are not looking for you not to see it at all. They actually would love for you to see it. And what they're looking for is for you to value it and have an understanding at minimum that they have the same love for their uniqueness and where they come from as you do. And so they would love to share it with you, love to share their culture, love to have you be part of it, like join the party in a way. But what's missing there is the also assigned same value to what they bring to the table, I think. And so there's somewhat of an assumption under there that assimilation into the majority, or having it be looked at as the majority culture or white culture is actually the better thing. And I think that's the thing that's not acknowledged. And I think most people not in white culture don't feel that way at all, right? They're very proud of the culture that they do come from. So I think the push is for us to see that although we're all very different, we should appreciate those differences and have them have equal respect, and actually really think of the differences as a value. That is what makes America different. That is what makes us be able to sort of solution and come up with all these sorts of things that maybe other countries can't, but we only have that ability when we actually do appreciate that diversity and bring it to the table. I think something that can actively be done, as you know, most organizations and corporations are run by white people, by white males in particular, is to have a commitment to a couple of things, which is education, right? I think, people didn't even know Juneteenth existed or what it was, right? And African Americans have been celebrating that. That's like our biggest party in the summer sometimes, like much more so than July 4th, So just educating yourselves on like what might be important to others, what are other things that we can lift up, learn from. And that is an American history piece. Juneteenth should not be just about African American history. This is like when America ended slavery. So like all Americans to me should celebrate that if that's what we're about. The other thing I think there should be a commitment to is representation. I think you don't know what you don't know. Just like I can't speak to what it's like to be an Asian male in this country. But I can hear about it and learn about it and know a little bit more about it if I sit next to one and talk to them and have them at the table in an overall discussion of how we're going to handle an issue. So there has to be a commitment to having different voices, colors, lives, experiences at the table for any kind of policy decision, any kind of decision. So I think organizations can absolutely even commit to a number and say, we're going to keep this as policy right now and see how that goes, right? We're going to hold ourselves to this number and this way that we're dividing up to make sure that we are diverse and have those voices heard. And the other way, definitely for organizations, and where I've sort of argued in my organization and gotten support, is funding. I mean, where you put your money is what you sort of care about and what you have established a commitment to. So I think through Anthem and through our foundation, actually, we've even done other things around supporting testing in areas that are like Black and brown neighborhoods for COVID-19, things like that. You have to put your money behind it and your time behind it. And if you hold yourself to those things, you'll see the diversity increase and the diversity of solution and problem solving as well, and better outcomes for everyone.
So Garnet, let me ask you kind of the same question. What advice, how can I be better? How can white people of good intention be better at addressing racism, be better at being anti-racist, and help understand our Black neighbors and colleagues and their human experience, what they go through? How can we do better at being good? I guess just be better.
Ask them, have the conversation. I don't understand. Tell me what it's like to be you on a daily basis when you step out of the house or you're sitting in a meeting at the office or whatever the case may be. Like I had to ask myself with the Me Too movement, am I doing something that is offensive to women? And am I checking whether or not I'm living up to my values by listening to the people around me and listening to my own voice when I'm talking to my staff, talking to my friends, my colleagues, whatever the case may be, that are women? Because, quite frankly, it's very, very similar. I can't be a woman, but I can certainly ask questions. And I have colleagues that are willing to educate me about what is a microaggression to them when it comes to their gender and how they traverse the world around them. And we have conversations about it. What is it that happened to you today that that offended you by your colleagues who happen to be male and happen to be, quite frankly, dissing you on a daily basis? When those same male colleagues dissed me because of my race, I said, I know how you feel now. I didn't get it per se, but I actually get it. I felt so little when they didn't think I could handle my business on the floor, and that's how they treat you. And now I really know. But it's those conversations that let us see that we all are suffering from these slights that happen. I mean, we only have 8 Republican women in the Texas House, only 8. And so when I think about it, with our 17 Black people in the Texas House, that's a small number. And they can't get from up under the slights and those microaggressions and that sexism that occurs on a daily basis. So these are equal things. And that's why I said if we could do something to deal with biases and those circumstances, it would work a lot better for all of us if we're willing to go through that self examination. And that's something that's on each and every one of us.
Good stuff. I want to ask each of you this last question about what gives you hope. What in this moment right now gives you, a reason to be optimistic? And I'm going to give you the last word, Dr. Malloy. Mr. Hunter, what do you think? What gives you hope?
I think, as I said earlier, it's the scope of the folks that are engaged at this point. It's not, when you look at the peaceful protests, it's not just Black people out there in the streets by themselves. We're not alone in this. I think folks have recognized that, that humanity is a basic right. It shouldn't be something that's in dispute, that folks shouldn't live in fear to walk down the street because of the color of their skin. Because, today it's somebody that's Black, tomorrow maybe it's somebody Hispanic, next day maybe somebody. I think folks get that, and they have grown weary of this coming up over and over and over again and being marginalized. So what gives me hope is the scale. It's the fact that the conversations are still happening. It's the fact that there are concrete moves being made in a lot of cities and states. Just the fact that, as we mentioned, the fact that Juneteenth is now being spoken of more often. My dad grew up in Houston, Texas, so he knew. He taught me about Juneteenth early on. But my mom's family and outside of Pittsburgh, Pennsylvania, didn't know anything about it. And that's in the Black community. So I think the openness to education and understanding. Speaking of the Tulsa massacre in 21, giving more folks a sense of, what you hear and know about Black people is not just what you see on cops. That's not who we are. And I think that can lead to real change.
Yeah, good stuff. Representative Coleman, what gives you hope about the state of our conversation on race and racism today?
When I looked at the 60,000 people who were on the streets of my hometown, Houston, Texas, that celebrates Juneteenth and been celebrating it, in the wide variety of people who said enough is enough. They were saying enough is enough because it affected them and what they believe. And to have hope and optimism that this group of people, particularly young people, are going to change the world we live in. And I have friends who ask me, well, what are we going to do? You know, if you understand this stuff, if you leave office, well, who's going to take over? I said, well, the millennials. I said, they get it. I said, they get it across the board, no matter what their ethnicity or race, and keep challenging them to be the leaders they already are, because that's what's going to take us forward as a community, as a society, and one that is more so sharing of the origins of those different, of all the people in this country, and particularly in the South.
Yeah, Dr. Malloy, last words on this about what gives you hope?
I love this question because I have found that a lot of things do. Well, there's so many things that are so tough to deal with in all of the situation. I think there's a lot of things. I think what Eric and Garnet said around the broad coalition as well. I mean, I've been teary-eyed over a number of things, good and bad, these past few weeks, but actually one of the things that's like sort of tears of joy is there are really people who don't look like me, like fighting their heart out for me, you know, people who do look like me to be recognized and to just be treated like they are. And I really feel like they feel it, they get it, they have friends, they've heard their stories, they know, they like actually really believe it. And I didn't realize even until I saw it sort of on camera and they would stop people at rallies and interview them, how much that personally touches me. And that is different from a lot of other times where there've been, you know, protests in the street. And that makes all the difference, just how it feels to even go through this as a Black person, this time with everyone. I really like that they have specific demands. Like they have really landed on a couple of areas where a lot of people agree. And underneath that to me, which is a lovely thing, is that there's a realization that we are all so much more the same than different. And I think, again, that's because people have just interacted with people and learned to love and care for people of other kinds, more so than say, 50 years ago. And so they have that sort of genuine just appreciation in their life that we're all the same. And so there's like, of course we can find common ground. Of course we can find things that all of us agree on to make better. I like that people have checked on me, like people in my life that I didn't even know they have called to be like, how are you doing during this? This must be tough, or tell me what it's like for you. I think that's an amazing thing that's also giving me hope. I've been very pleasantly surprised by some of that, and some of the greatest conversations in the last few weeks have happened because of just that question to me and that discussion. And then like, lastly, I think there is so much, there's a lot of technology, there's a lot of information out there, and even more so than if you go back 10 or 20 years. So it's like, there's no excuse to not be educated. It's like so easy, even if you're embarrassed that you have such a lack of knowledge in this area, just Google it and there will be a ton of things that pop up for you to look at, to click on, TED Talks, documentaries, like even, things like, from Ava DuVernay or authors like Ibram Kendi, or like, there's just so many things to find and have at your Netflix fingertips so easily these days. And I think that to me helps me think that we can get the message out in grand form, in lots of different medium that actually really touch people and have them see with their own eyes what's going on. And so it touches them in a different way. And so sort of all those things together just make me think that it's a different time and there's a different sort of maybe capacity for moving it forward quickly at this point.
Yeah.
We're all the same.
Good stuff. Eric Hunter, President and CEO of CareOregon, Dr. Demetria Malloy, Senior Medical Director of Plan Performance at Anthem Blue Cross, California Medicaid, and Representative Garnet Coleman, 30-year legislator out of Houston, Texas. Thank you guys for being part of this. I was reading some Martin Luther King ahead of Juneteenth, and I would say for those of you watching, if you don't know much about Juneteenth, there's plenty of stuff out there with a Google search, particularly on Wikipedia, just to learn a little bit about it. And one of the things we can do with our privilege and power in whatever shape and form it has is to have conversations like this, have it with our kids. And I reflect on this passage from King's book, Strength to Love, that says and reminds us that darkness cannot drive out darkness, only light can do that. Hate cannot drive out hate, only love can do that. So carry love with you when you have these conversations. Thanks for watching. We'd love to get your feedback when we send this out, a survey out to everybody who participated. So please let us know how we did. And we will have more of these coming up as soon as next week on different topics here at State of Reform. Thanks for watching.
Thanks for doing this, DJ.
Thanks for joining us in this virtual conversation and for your support of our work at State of Reform.